So the focus today is on disorders in childhood and adolescence, emotional, elimination, sleep, and eating disorders. So pause the video here, read this case study, and then we'll apply it to anxiety disorders, separation anxiety in childhood. Okay, so separation anxiety disorder. These children have an intense fear of abandonment. They are scared and miserable when they are away from significant others. And they become very, very distressed when they're separated from their parents. At home, they fear that something will happen to caregivers or to them. And so the solution then is to shadow the parent around the house nonstop. And the idea is, if I can see you, you can't leave me. You can't abandon me. So these kids then put up a lot of distress at the thought of being separated from their parents or significant others. Oftentimes this results in refusal to go to school. Mention of separation brings about somatic symptoms. So these are physical symptoms, right? You're expressing your emotions in a physical way. Things like complaining of headaches, vomiting, nausea, stomach aches, and then, if these children actually do go to school, oftentimes they will complain about these somatic concerns at school so that they can go home, so that they can be with the caregiver again. Oftentimes this starts after a significant life stress. So if the child has experienced death in the family, illness, change in the environment, and they basically need or feel that they need the parent to be able to cope with this significant life stress. So for treatment then, you might take transitional objects with the child, such as a blanket or a stuffed animal, something like that, that the child feels comforted by. Gradually increase the time that the parents and the children are separated, and then also to help parents manage their own anxieties. So children are very sensitive to anxiety in their parents. They can tell when their parents are feeling anxious or fearful about something, and children feed off of this. So teaching parents how to manage their own anxieties can be very effective here as well. Elimination disorders. So these have to do with the elimination of bodily fluids. Okay, so first we have enuresis. So with enuresis, we are looking at the elimination of urine. And so with enuresis, we have a lack of bladder control past the age when such control is expected. So you wouldn't diagnose this until about age 5 for enuresis. Oftentimes this results out of anxiety, fear about using public toilets. These kids can develop, a real fear of that. In terms of treatment, we're looking at retention control, so basically teaching children how to delay going to the bathroom to build up their control, and providing them with tangible reinforcements, providing them with some kind of reward for going to the bathroom, for holding their bladder, essentially. You can also use conditioning devices. This is like an alarm that you would put on the child's bed so that they don't wet the bed at night. And the alarm goes off as soon as any kind of liquid hits the pad. So the kid then learns to interpret bodily signals for having to go to the bathroom. Encopresis, lack of bowel control past the age when such control would be considered normal. So for children then, this would be about age 4. There are 2 types of encopresis. So these kids might have, again, this anxiety about using public toilets. They develop constipation and then develop an involuntary overflow of incontinence. There are also kids who use bowel smearing as an oppositional way to kind of deliberately get back at individuals. So they deliberately smear feces. They may also have a fear about using the toilet. So they might feel like they might drown if they use the toilet, or there's snakes in the toilet. And this can also begin as a reaction to stressful life events. So let's say that, a sibling has just entered the family, a new child, they're starting school, maybe one of their parents is starting a full-time job. And so, this can develop as an anxious reaction or reaction to these stressful life events. So for treatment for encopresis, we're looking at regular toileting times, making the child clean up the mess, and adopting this kind of no-nonsense approach to it. It's like, well, you just made a mess, so guess what? You're going to clean it up. And for parents then, developing this approach where they don't shame the child. You don't want the child to feel that, you know, they're a dirty, disgusting child for this kind of problem here. You know, you want to take a no-nonsense approach and just, you know, have the child clean it up, and that's the end of it. Okay, so sleep disorders, problems with sleeping. So children can have problems with nightmares, particularly disorders of REM sleep. So remember, REM sleep is that rapid eye movement sleep. That's the most restorative. So some children have nightmares that occur frequently in childhood, much more than during later years. And these kids show no particular physiological arousal, and they may or may not be awakened during the dream, but they're usually able to recall their dreams in vivid detail. Now, less prevalent but more disturbing are what are called sleep terrors or night terrors. Children who have these show intense physiological arousal. So oftentimes, you know, they will be screaming in the middle of the night, and you can imagine how jarring this is for parents. They're very, very hard to comfort. They have no memory of the episode in the morning, okay? So they do not remember, you know, having this very, very disturbing experience in the evening with sleep terrors. Okay, eating disorders. Few kinds of eating disorders that we'll focus on. Anorexia nervosa. Anorexia is about self-starvation. So severe restriction of food caused by a fear of gaining weight. With bulimia nervosa, this is characterized by periods of binging and purging. So a binge, that means you're consuming a large amount of food in a discrete amount of time. So this can be consuming something like 1,500 calories in a 2-hour period. So a very, very large amount of food in a small amount of time. That's the binge part. And then there's the purge part. You have to get rid of the food in some way, some kind of compensation. So this can be vomiting, this could be laxative use, this could be excessive exercise. So bulimia then characterized by binging and purging. And then focusing on childhood obesity as well. So we have an epidemic in the United States where more and more children are overweight and obese. And this can produce some pretty serious psychological consequences for these children. For example, things like weight-related teasing. These kids can't participate in activities the same way that other kids can. And this kind of teasing and, you know, social disconnect from other activities that kids are doing can result in low self-esteem for children who are overweight or obese. So this chart here shows the multiple ways that bulimia can affect your body. So notable things here, particularly if the individual is engaging in vomiting to get rid of the food. They can experience erosion of their teeth enamel from the acid in vomiting. They might have scars on the back of their hands from sticking their fingers down their throat. Their throat and esophagus oftentimes are very, very worn, very tender. It also messes with things like your heart, right? Your heart needs food to be able to perform essential life functions, and these eating disorders really impede that ability. So let's talk about eating disorders and culture. And so in the United States, you know, the emphasis is really on a thin figure for women. That's seen as the dominant thinness ideal. But in many cultures where food is more rare, being large, being overweight, being fat, if you will, is a sign of health and affluence, and also of sexual desirability in women. So women need a certain amount of body fat to be able to carry a child to term. So if you are overweight, this signals to men that yes, you are fertile. You have the fat repositories to be able to carry a child. So looking at the cultural ideal for men also, there used to be this dominant perception that if you were muscular, this signified that you were from a working class background, that you didn't have the education level or the money to be able to have a sedentary desk job, where you're sitting at a desk all day doing nothing. If you had muscles, it meant that you were working in a field, you were doing manual labor. Now, though, that ideal seems to be changing, where muscular bodies symbolize affluence. They symbolize that you have the time to be able to go to a gym and work out. They also symbolize that you have the money to be able to afford a gym membership to be able to do these things. Okay, so this is what's called the figure rating scale, and this is a scale that I have used in past research, looking at how different cultural groups conceptualize what is considered attractive. So I gave this scale to African American women and to Caucasian or white college women, and asked them to pick the figure that is represents most closely what they think they look like right now, and then what they would like to look like. And I found that white women chose this figure, number 2, as their ideal. Black women chose between a 4 and a 5 as their ideal for beauty. So that indicates to us that there is some discrepancy here, right, between cultural groups in what is considered attractive. African American women, on the whole, tend to have a much more positive perception of their body, and they tend to prefer a fuller figured female as attractive compared to white women, who are more likely to prefer this extremely thin woman as their attractiveness ideal.